Hi and welcome. I'm Beth Dolan. I'm the interim dean of the College of Health at Lehigh University. And I'm really excited that you joined us today for this very interesting talk. The talk takes place in our spring focus on nutrition within our population health colloquium. As most of you know, the College of Health is in its third year. And so this is the sixth population health colloquium we've held since we've opened. Each one has a theme, and the reason for the theme this semester is to celebrate the publication of a book by one of our faculty members who's here with us today. So I want to introduce to everyone Ed Gomez, Dr. Ed Gomez, who is associate professor in the College of Health, as well as director of the Institute for Health Policy and Politics. And he published a book that came out earlier this year in 2023 with Johns Hopkins University Press called Junk Food Politics: How Beverage and Fast Food Industries Are Reshaping Emerging Economies. And to celebrate that, we've brought in other really leading scholars in the area of nutrition for 3 sessions. So this is the second of 3 colloquia that we are holding. The next one will take place towards the end of April, April 24th. So be on the lookout for announcements about that. Just one quick note before I turn it over to Dr. Gomez. We invite conversation in these colloquia. So there'll be about a 45 minute presentation by Dr. Iannotti, and then we'll move into Q&A. So please feel free to enter questions using the Q&A feature at any point during the presentation, and we'll get back to them at the end. So welcome, and Dr. Gomez, let me turn it over to you.
Wonderful. Thank you, Dean Dolan. Thank you, everyone, for joining us today. It's such an honor for you to join us. Today, we're honored to have with us for this event, Professor Laura Iannotti in the Brown School at Washington University in St. Louis. And Professor Iannotti has expertise in maternal and young child nutrition and nutrition deficiencies related to poverty and infectious diseases. She applies epidemiological methods to investigate interventions aimed at reducing stunted growth and development. Professor Iannotti leads projects in Haiti, Ecuador, and East Africa, where she collaborates with local partners to test innovative transdisciplinary approaches using animal source foods and small livestock and fisheries development. She is a founder and director of the E3 Nutrition Lab, working to identify economically affordable, environmentally sustainable, and evolutionary approaches to nutrition solutions globally. Professor Iannotti received her doctorate from Johns Hopkins University Bloomberg School of Public Health, a Master's of Arts degree in Foreign Affairs from my alma mater, University of Virginia, which I'm very excited about. Prior to pursuing her PhD, she worked for over 10 years with UN agencies and non-governmental organizations on nutrition and food security programming and policy. She serves on public health advisory and journal editorial boards and consults with the WHO, International Livestock Research Institute, among other international organizations. So thank you very much, Professor Iannotti, and we'll pass it over to you.
Great. Thank you, Dr. Gomez, for the kind introduction. And thank you very much for inviting me to participate in this colloquium. I'm excited to hear some questions later and have dialogue with the participants. I appreciate that you were able to join. I'm going to share my screen now and put this in presentation view. So do let me know if that is not visible. As Dr. Gomez says, I'm going to talk about animal source foods and our work in young child nutrition in particular, how this has moved from evidence into policy. So for the presentation, I'll start with just an overview. It sounds like the colloquium series has a thematic focus on public health issues. So I'll talk to you about the sort of, global nutrition public health disparities that exist around the world, and then provide some rationale for why we focus on animal source foods and child nutrition. Then I'll introduce you briefly to two of our projects to kind of give you an example of how we test animal source foods in the field and in research. The Makuna project, which focuses on maternal nutrition, and then the Samaki Salama project in Kenya, which has a focus on child nutrition. And then I'll conclude with just an overview of some of the policy work that our group has been engaged in, and what seems to be on the horizon, which you can imagine is largely about the environment and animal source foods contribution to climate change, and how we're sort of positioning animal source foods in that debate. So as Dr. Gomez said, I'm director and founding director of the E3 Nutrition Lab, and we do research to identify maternal and young child nutrition interventions, upholding the three tenets or three principles of equity, evolution, and the environment. Our projects are in Ecuador, Haiti, Kenya, and Madagascar. And then, as I said, we take those learnings up to the global level for translation into policy with WHO, FAO, and UN Nutrition at the moment. So around the world, the focus of our research is on stunted growth, and we have about 149.2 million children under 5 who experience stunted growth. They're not growing to their full developmental potential because of deficiencies in certain nutrients and malnutrition. 250, a large proportion of that, experience stunted development. And then there are issues of wasting, overweight, and obesity. At the intersection of undernutrition and overweight and obesity is a problem called hidden hunger. And Dr. Gomez probably touches on this in his book, but this is the issue when people do not have access to high quality foods, and they therefore are lacking in certain nutrients that are found in those foods, so higher quality diets. About 1/3 of children around the world are vitamin A deficient. 1 in 5 people around the world are likely to be zinc deficient, and I'll show you some of those disparities in a minute. Then we also have the problem of iodine deficiency, which is inexcusable from my point of view, given we have affordable solutions to this through iodized salt. And then the problem of anemia, some proportion of that is related to iron deficiency anemia. And again, those poor quality diets. So this world map shows you some of those disparities that I was referring to at a population level. You can see that the countries or the regions that are in pink are those with very high levels of stunting among young children. What the map does not show you, however, I think this is very important to understand, is that there are extreme disparities within countries. So even in our country, in the city where I live, in St. Louis, you have the issue of hidden hunger and disparities in nutrition. Here in this map, it portrays the availability of zinc in particular. And it has the overlapping regions that just showed up in the stunting map. And again, this highlights the lack of access in certain populations compared to others for these high quality foods. And this is part of the rationale that we use for focusing on animal source foods. Animal source foods actually have high concentrations of zinc in bioavailable forms, and I'll explain that in a minute. In global public health nutrition, we emphasize the first 1,000 days of life, because in the first 1,000 days of life, if there are insults or lack of certain nutrients during that period, you can have irreparable harm and consequences that last through a lifetime. So the first 1,000 days of life is the focus of our research, pregnancy through 2 years of age. However, I like to show this slide just to emphasize also that beyond 1,000 days, we have ongoing brain development, and some of that science is still unfolding as we think about how does nutrition influence brain development. And we can see that this is ongoing through, you have synaptic growth, plateaus at around 2 years. Myelination continues to rise through adolescence. And then we have glucose and oxygen consumption that peaks around 5 to 7 years. But we know the school-age child, it's critical that there is good nutrition during the school period. Okay, so now I'm moving into the rationale, the nutritional rationale for our focus on animal source foods. Animal source foods are very important in certain periods of the life course. As I mentioned, the first 1,000 days of life, so during pregnancy and lactation, but then through 2 years of age. So after the exclusive breastfeeding period, it's for 6 months. There's the period called the complementary feeding. It's one of the most nutritionally vulnerable periods in the life course. And animal source foods are especially important in that time period because of the small gastric capacity of infants and the need for really bioavailable nutrients being delivered in animal source foods. And then globally, there has been some, I would say, neglect of or lack of focus on older adults, but the literature and the evidence are growing for the importance of animal foods in older adults as well, for cognition, for memory enhancement, for preventing sarcopenia or muscle wasting, for protecting against bone health, for protecting bone health. It's an area of research that's needed as we move forward. So this slide gives you a visual sort of depiction of the difference between certain nutrients in plant-based foods versus animal source foods. So vitamin A is probably the best example. In plant-based foods, it generally comes in the form of carotenoids. So for example, beta carotene in carrots. But we need 12 to 24 times the amount of carotenoids to get to the form or the compound that we absorb readily, which is retinol. And that is the form that comes delivered in animal source foods. So as I mentioned with young children, when you have a very small stomach or small gastric capacity, you need foods that are efficient in delivering those nutrients. This is also true for iron, for zinc. Iron comes in the form of hemoglobin, and it's 2 times more absorbable and metabolized more efficiently than the plant-based food. And zinc as well, 2 times the rate. Choline is found in higher concentrations in animal source foods, not necessarily in bioavailable forms. So eggs are a good example of a choline-rich food. This shows you some of those disparities that I was mentioning before and people's lack of access to animal foods. You can see, for example, in Europe, there's high levels of intake, food supply of milk, for example, as compared to the region of Africa. And around the world, there's increasing consumption of animal source foods, but only in certain regions. Our lab focuses primarily on these foods. So we focus on eggs, milk, and fish. And why these animal foods? Well, small fish in particular. These foods tend to be more sustainable. They also tend to be more affordable to very poor populations. So we conduct trials to test their effects on child growth and brain development as a food source that may be accessible to certain populations. Now, before going into the countries where we work or the communities where we work, we do formative research to ensure that the foods are valued by the communities, to ensure that those foods are available to those communities. So I very often get questions around, the sort of cultural acceptance of the foods. And all of that is done as formative research to ensure that the foods will be there when we leave and that they're affordable and culturally acceptable. One of our trials in Ecuador forms the basis for why we've continued to focus on eggs. And this was a trial that we conducted in Ecuador. It was a randomized controlled trial. And we tested a simple intervention of 1 egg per day for 6 months, introducing the egg at around 6 months of age, and then following the children for 6 months. And what you can see here is a pretty dramatic effect on length for age Z-score and the reduction in stunting that we saw from this simple intervention. So the distribution in the right panel in the egg group shifted to the right in the by end line after the intervention. It demonstrates, again, this population level effect where the entire distribution was shifted and all children were growing closer to their growth potential. But then undergirding or underlining this growth effect, we also had an effect on biomarkers, which was validating for the large growth effect. We saw increases in choline concentrations in the blood, as well as docosahexaenoic acid, which is the long-chain fatty acids that you find usually associated with fish. So it was a little bit surprising that we also found this big effect in eggs consumption. Now, following from the Laloon trial, we've started a new study in Ecuador that I'll introduce you to, and this one is called the Mucuna study. And here again, we're doing a randomized controlled trial, and we are using mixed methods to look at the effects of a dietary pattern. So as compared to a single food like eggs, we're now testing an entire dietary pattern, which includes fish, eggs, and fruit and vegetables. We're targeting a mixed indigenous community in peri-urban and rural areas. And the intervention is lasting from during second and third trimesters. We're using social marketing to promote dietary diversity and the intervention itself. The primary outcome for the study is newborn length. But then interestingly, for this study, we're looking specifically at brain development. So we're using this field-friendly technology of ultrasound to measure different parts of the brain and whether or not it's responsive to nutrition. Here again, this portrays the longitudinal study, which for those of you conducting field research similar to this, I highly recommend. It gives you great statistical power, and looking at the difference longitudinally allows you to sort of take out the confounding factors that might result in bias in your findings. So the outcomes, again, growth, brain region changes, blood biomarkers, and newborn development. Here's a list of the foods that we're testing. And holding up the principle of sustainability, we are sourcing the foods locally from native fruits and vegetables to the extent that we can, from a group called Amazonia Gardens. It's a diverse range of fruits and vegetables, not all 100% accepted by the moms. There's some encouragement that is required to teach them how to cook or use certain herbs or fruit and vegetables. And then importantly, and probably related to the talk that Dr. Gomez gave last week, we're also discouraging ultra-processed foods. So this is unfortunately a big part of the diet in Ecuador. And our hypothesis is that by eliminating that, as well as introducing these high quality foods, that we can have an effect on fetal and newborn growth outcomes. So here's a picture of the Amazonia Gardens where we're sourcing the foods, again, in a sustainable way. And then this shows you some images from the social marketing campaign to promote these different food groups. We use social marketing both in several of our countries, actually, not only to promote the behavior change that we're working on, but also to encourage ownership and participation in our studies. Laloon, for example, we had a volcano erupt in the middle of the study, And we're very proud that we didn't have any losses to follow up. Everybody was fine, but they also stayed engaged in the study because we had worked hard to make sure that they felt important, both the control group and the intervention group. So this is usually some constellation of intervention or package of activities that might include soccer games or picnics or things that make everybody feel like they're part of the study. We give small gifts. In the Makuna project, for example, we're giving baby blankets and different items that have the logo on it. And this helps engage participants, and we have very low losses to follow-up because of this. Then, as I mentioned, we have different time points where we're collecting data, and we're looking at maternal nutrition, maternal diet, and morbidities, as well as some maternal blood biomarkers. And these are listed here: choline, betaine, methionine, DHA, some long-chain fatty acids as well. And then we're also looking at a whole spectrum of minerals and metals in the blood, using fetal and newborn ultrasound and maternal anthropometry. Sorry, newborn anthropometry. Okay, so moving now to Samaki Salama, which is the second example I want to give of research that we're conducting to look at the effects of animal source foods. And this trial has now been complete, and we're in the process right now of analyzing data. And we have some preliminary findings that I'll share with you, although they're not published, and I want to emphasize that they're still preliminary at this point. Our partners in Samaki Salama project are Pwani University, Egerton University in Kenya, and then University of Rhode Island. And we have co-PIs across all of those institutions. So Samaki Salama is targeting small fisher households. And this is true around the world, that small scale food producers tend to be, ironically, some of the most malnourished communities and populations that we see around the world, despite producing a good deal, at least 50% of nutrients. In this case, on coastal Kenya, we have high prevalence of stunting along the coast and in these small fishing households. And what we found in our formative research is that quite often, instead of keeping the fish, the households are selling them in order to buy ugali or maize that may not be as nutritious for the young children. So in Samaki Salama, in contrast to the Ecuador trials, we used a cluster design, and this was in part because of the intervention, which was distributing these modified traps that you can see in the photo, as well as the social marketing. And we were worried about spillover by having an individually randomized controlled trial. So this has been challenging to think about the selection bias that can occur in a cluster design, but we're working on that right now to better ensure that there's comparability across the communities. So the aims for Samaki Salama were to compare the efficacy of this 12-month bundled intervention on young child growth, examine the impacts on fisheries yield and biomass, fisheries earnings, and changes in diet diversity and fish consumption. And this project was a really cool team. We used a team science approach. So we have experts in public health nutrition, but also in marine ecology and ethnobotany and economics and anthropology, behavior change communication. So it was, the intervention really was very multidisciplinary in its nature. And we were aiming to not only protect child health, but also to protect ecosystem health. It's funded by USAID Feed the Future. So the sites for Samaki Salama, you can see in the map on the right, in the top two in blue. We used the social marketing plus the modified traps as our intervention. And the modified traps, I'll show you another photo in a minute, allow the juvenile fish to escape and just keep the adult fish, which allows for some protection of the ecosystem. Then you can see in green, we had an arm that is just social marketing. And then finally in red are the control groups. Here's some images from the social marketing intervention, which was an extensive and really well-delivered piece of this project. So there was home visits where the field team used dialogue to talk to participants, to engage them to find out where they are in terms of their knowledge and understanding, but also to meet them where they are really in terms of understanding and behaviors. It was a very tailored approach to changing behavior. We used cooking demonstrations to encourage the households to give fish to the young children and encourage certain preparation methods such as frying with a little bit of oil to allow for those fat-soluble vitamins to be absorbed by the children. Here's a picture of the modified traps. And again, you can see the escape valve there that allows the young fish, the juvenile fish, to escape. And now I'll show you some of the preliminary findings. So in terms of baseline child health across all the coastal communities, we saw very high levels of stunted growth at 20% at baseline, and acute diarrhea was extremely high at 24%. We had pretty low dietary diversity score at baseline, 3.3 food groups on average, and only 8% of children meeting the minimum WHO standard of 5 or more food groups per day. Social marketing change intervention was successfully implemented through these household visits and tailored targeted messaging. Then in regression modeling that we adjusted for confounding because of that cluster design, we show that the Samaki-Salama intervention successfully improved child dietary diversity score in a dose response manner across each arm. Unfortunately, we were not able to increase anthropometry, and there are some reasons for that. What you can see, though, however, is that we did shift slightly to the right the arm 3, which is social marketing and modified traps. In a non-significant way, it seems that there was some improved growth in the children. So next steps are that we plan to continue to work on this intervention, perhaps on a longer basis, to see whether or not the behavior change occurs over a longer period. The key findings from the fish catch is that we did increase fish biomass of greater value, statistically significant, although not a huge ecological significance. So the conclusions from this trial are that we improved fish catch characteristics, albeit marginally. We increased child dietary diversity with the social marketing, so the behavior change was accomplished. And we improved child growth by adding the modified traps to social marketing, although not significant relative to the control. As we move forward, we perceive Samaki-Salama to be an innovative trial that has this holistic approach to improving child nutrition using sustainable production, behavior change, and the sustainability tenets. Other elements could be further tested, such as water sanitation and hygiene, and other gear types, perhaps for sustainability. Okay, so I just have a few more concluding slides to tell you just a little bit about the policy work. In order to take these findings and use that evidence-based approach to work on improving young child nutrition, it's to our lab and to others, our collaborators, that we now move into this translation phase. So the E3 Nutrition Lab is involved in helping. We have representation on the WHO Guidelines Development Group, developing guidelines for complementary feeding of the breastfed and non-breastfed babies. And then we led the FAO Global Assessment on the contribution of livestock foods to food security, sustainable agri-systems, nutrition, and healthy diets. In the past, we worked with UN Nutrition on 2 papers on aquatic and terrestrial animal foods and sustainable healthy diets. and then currently representation on the NIH bonds or biomarkers for nutrition and development. As I mentioned earlier, one of the most important things that we need to think about and work on right now with regards to animal source foods is the contribution that these foods are making to climate change, unfortunately, and to losses in bioavailability. So we know approximately 60% of greenhouse gas emissions, for example, result from food systems. And there are also losses in biodiversity and losses in freshwater retrievals that come from food systems. So it's one of the most important critical issues that we can focus on. Our lab is thinking about the overlap or the intersectionality of diet diversity and biodiversity and working on that right now in a wild edible foods project in Madagascar. And then this sort of this notion of nourishing biomes, as was a good example from the Samaki Salama project, where we protect the marine ecosystem as well as child nutrition in these small fisher households. So with that, I would like to say thanks to these amazing teams in our various countries and in my lab, and conclude and open it up for questions at this point.
Wonderful. Thank you so much, Professor Iannotti, for this fantastic presentation. Learning so much, and really wonderful to see that you're doing these interventions in Ecuador and other countries. And we just know so little about these issues in other countries. But why don't we go ahead and open it up to any questions from the Zoom audience? And again, if you could just push your Q&A button there on the Zoom, and then I'll just read your questions as they come in. Well, while we wait for some questions, I have one for you, if you don't mind. I really enjoyed your discussion about sort of the challenge of dealing with ultra-processed foods. And as you noted, it's something that my research is on, and sort of the government policy approaches to that. So my question is, what do you think is the most effective way, based on your research, on trying to discourage the consumption of these foods and encourage animal-based foods, seeing how much of a strong impact that is? Do you think that the focus should be on government policy, or alternatively empowering communities, like you mentioned, with the different social marketing strategies, and empowering and countering the innumerable marketing strategies that ultra-processed foods have? In my book, I mentioned one example of Nestle, what they used to do in the Brazilian Amazons, going throughout the Amazons and Nestle boats. And so what do you think is the most effective policy intervention, in a way, to sort of discourage and transition from ultra-processed food consumption to these animal-based foods for young children?
Yeah, thank you for that question, Dr. Gomez, and I would really like to read your book. Unfortunately, I have not yet done that, but I will make a point to do that. I think it is one of the most important nutrition problems right now, is the overconsumption and the marketing of these ultra-processed foods. It's so part of what the rationale, and I didn't really present this in the PowerPoint. So that one of our E's in the E3 Nutrition Lab is evolutionary nutrition. And the rationale being that, for 2 million years, we were consuming foods from a gatherer, hunter, fisher, foraging existence that did not have ultra-processed foods in the mix. And those foods have, you think about agriculture introduced 10,000 years ago, a fraction of our evolutionary past, but then ultra-processed foods is a tiny, tiny fraction of our evolutionary past. So genomes are not built to metabolize these foods, and it's causing a great deal of harm globally in terms of population health. I think, the solution should be, at multiple levels. So it absolutely has to be at the policy level, where we are keeping accountable these large-scale industries that have a great deal of resources to market and to promote these foods, as well. So controlling or, increasing the price of, quite often they're very cheap, these foods. But the other reason that we find in our field sites that they're consumed, and I would say probably even in my own household, is because it's convenient, right? And a lot of women don't have time. So our lab we're also working on this issue of time scarcity and the importance of how do you make more healthy foods, reduce the time in preparation or reduce the time, and because people don't have time, and discourage the use then of the unhealthy ultra processed foods. So it's both. It's behavior change, it's programming interventions that would discourage the consumption, but it's also policy level interventions. So super important issue for sure.
Thank you so much. I totally agree on the issue of time. Yeah, absolutely. Thank you so much. We have a couple more questions here. The next one is, thank you. This is from Vanessa de la Cruz. Thank you. Fantastic presentation. How these projects can be scaled up to other lower middle income countries. Other contexts, for example, in some cities in Mexico, water scarcity is a big issue and clean water is not free, unfortunately.
Yeah, that's probably one of the most important questions when you're thinking about population health or public health is context. So every context is going to be different. And this is what I love about public health, is that it's so much fun intellectually, because you have to consider that multitude of factors in each context, whether it's water scarcity in Mexico or, in the case of Kenya, the example that I showed you, we have, it seems a big problem in water sanitation and hygiene along the coast because we have these very high levels of diarrhea. So in order to understand your context, that first phase of formative research is critical. And not every intervention is going to work in every context. That is absolutely the case. So just as an example, we finished our Laloon trial in Ecuador with eggs, successfully showing that we reduced stunting and that we, improved linear growth. And then a certain funder, and I won't say their name, said, we need to replicate this right away, tomorrow. We need to do this in Malawi, and we need to do it in this particular part of Malawi because we already have research infrastructure and we can do it tomorrow. But this part of Malawi was along a lake, and the children, we knew it wouldn't work. There were contextual factors that precluded that, and that was that the children were already consuming animal source foods. They were consuming fish from the lake. We knew that they didn't have baseline stunting in the same way that Ecuador did. So you have to really understand your context before you assume that an intervention would have an effect.
Yes,
it's a great question.
Thank you so much. Great. The next question is, when you discuss an animal-based diet, you primarily discuss eggs and fish. Do you think chicken and red meat are also important in animal-based diet? It's often said that red meat causes cancer.
Yeah, that's a very important question too. And I, with FAO, I think I mentioned the Food and Agriculture Organization, we led the writing of a massive report. It was 300 pages. And there were 2 paragraphs on meat. And those 2 paragraphs took more of my time than any other because of the controversies in terms of the environment. And as this person is saying, the chronic disease risk that is in the literature, although you have to be really careful about discerning those chronic disease risks. So if you look carefully, there's been several systematic reviews that show, and meta-analysis that show pretty pretty consistently that that processed meats lead to cancer and are associated with risk of cancer, but not necessarily unprocessed.
Mm.
So there's some contention there and debate. In terms of our research, we haven't focused so much on chicken and meat because they're more expensive.
Mm.
So we work in very poor communities, and to have a sustained effect that is sustainable, those are not generally our animal source food of choice.
Mm.
But I guess my simple answer to your question is I think all foods are important. We need diet diversity. Well, okay, not ultra processed foods, but we really need, all humans need a diverse diet. So a little bit of meat is okay and good, probably in some cases.
Great. Yes, I agree. Thank you so much. The next question is, thank you for a sensational presentation. How could food industry be involved in these types of projects? Is there a role for them?
Ooh, that's a tricky one. Yes, there's a really important role. I think food industry, as you can answer more authoritatively than I could, they're playing a pretty important role in driving our dietary patterns around the world. So they need to be involved. From a research point of view, we have to be very careful about who we work with. And my lab stays far away from food industry. We take no money from food industry. There has been historically some problems with conflict of interest, with research and, taking money from food industry. Even the case of the WHO guidelines development, it was really interesting. They had us make a declaration in order to vote on the WHO guidelines, to be on the working group for with voting rights. We had to make a statement about this conflict of interest. But then it was like, the CIA or the FBI, they went into our records to make sure that there was no conflict of interest. It's that sensitive in public health nutrition.
Right.
But, and maybe you can answer this a little further, they do play a pretty critical role, so we better involve them in some form or another.
Yeah, it's a great point. You're absolutely right. There are food companies that are involved in nutrition issues and stunting issues, and show concern, but the conflict of interest is very important. In my research in several developing countries, the whole issue of conflict of interest in nutrition research is not as clearly defined and is very problematic in terms of researchers where you face a context where they need funding, right, for their research, for their tenure. And the funding sources from government are not available, right? And so you have several cases of this being problematic, and not only for researchers, but for nutrition conferences. So that's a really important point. Thank you. The next question is, some argue that animal-based foods have severe impacts on cardiovascular health. Can an overabundance of animal-based foods be an issue on this?
Yes, like I was saying before, I think there's some controversy there. People will argue and get pedantic about who's the control group, and what is a healthy amount. But I think the simple answer is that, again, there are some countries in the world right now where there's an overconsumption, there's overabundance of animal source foods, especially in adult diets. And that is, we need to pay attention to that. We need to reduce consumption in those places. But there are many countries, the places where we're working, where there's underconsumption, and they have no access. So as an example, in Madagascar, where we're working there, these children are consuming only rice with a little bit of, food here and there, and you see severe malnutrition. So animal source foods, the only way to get vitamin B12, for example, is in animal source foods. But there are other bioactive factors like taurine that you find in animal source foods, but not in plant-based foods. So there's a risk to it completely eliminating them. And the literature on vegan diets is is starting to grow in terms of harms in certain periods of the life course. I think we should talk about, talk differently about children than we do about adults and the consumption of these foods, because children need it for healthy growth and for brain development.
Yeah.
But yes,
That's
it's a pretty contentious issue.
The sole issue about, the food sources at young ages is so different from at an adult stage, and you're absolutely right. Great, thank you. The next question is, how do you measure growth potential in children to get consistent data on the impact of certain diets?
Yeah, nice question. If you're interested in the growth standards that we use, if you just Google WHO, which is World Health Organization, growth standards, you'll get a whole sort of portfolio of tools that will allow you to do these measures. So essentially, WHO did new growth standards back in 2006 to replace the growth references that we use in the US with NCHS and the CDC. And basically what they did is they had a cool design where they were creating these optimal growth conditions so that we could get to standards as compared to references, so that we would have, and they did it in multiple contexts, back to the earlier question, so that we would have different populations and we would see, because sometimes people argue, well, in certain countries, they're just shorter, or in certain places, they won't grow in the same way. But we actually debunked that. We know that every human being on this planet can grow in the same way if given the right growing conditions. So for us, we use height and weight, and we place that relative to age, and you get these Z-scores that you can then compare to the WHO global standards. Yeah. And that shows you whether or not, in some of those distribution curves I was showing you, whether or not a child is getting close to that potential. Now, they're going to be somewhere on that distribution. Not all of us are going to be tall. Some of us are genetically programmed to be shorter. But what we want around the world is everybody getting to genetic potential. We want all the environmental factors ruled out so that everybody has that potential. And that's also because we know that it's a proxy marker for child development, for development too, so brain development. If everybody's growing taller, we know that they're probably also getting the nutrients they need for brain development. That was a little bit long answered, but
that's great. Thank you so much. That's great. Let's see here. There are no further questions. I just makes me think a lot about the dilemma that politicians are in developing countries when there's so much going on in childhood obesity and all the media on childhood obesity and diabetes, and we continue to forget the stunting issue. I was doing research with colleagues in Indonesia several years. We were working on this project. Unfortunately, we never followed up on the dual burden of malnutrition and overnutrition and undernutrition within families, all right, in households. And so societies are dealing with, parents that are overweight, children that are stunting. And so how do politicians grapple with, prioritizing policies when they're being, flooded with information about childhood obesity and the ultra processed issue? And so that's something that, what are your thoughts on that? I mean, what do you think is there a solution to that?
No, I mean, it's an enormous and growing problem, the dual burden. And you see that especially, you see that quite often in Latin America, but also in many countries around the world. And it's, it all comes down, from my point of view, to diet quality. So if you address the problem of poor diet quality, having enough diversity in the diet, fruits, vegetables, and animal source foods, just a wide array of foods. You take out ultra processed foods, that's going to simultaneously address stunting as well as overweight and obesity. And what you can see at the policy level is that more countries are moving in the direction of promoting dietary patterns. And that's a good shift from my point of view. So if you look at the US dietary guidelines, the most recent ones, that they use that word all the time about dietary patterns, and they talk about, eat from this food group or eat from this sub-food group. And I think that's important again for both of those problems.
Yes.
And other, there are great examples. Brazil is a great example of national dietary guidelines that are super. Canada, there's several countries around the world that are at least moving in that direction, which will have positive effects.
I think you make a great point about quality access. I think governments are always really worried about access, and they see ultra processed foods, even though they don't look harmful, as a great solution, but quality is the key. And how do we convince policymakers that it's quality, not access, that is the solution, right? And so that's, I mean, as you said, Brazil, they've been doing this for many years. The country that I've done my research the most, Mexico, a lot of countries, Chile recently, a lot of countries are doing fantastic work on dietary patterns, but still a lot, obviously, in a lot of countries, and even in our own country, right? on this issue. So that's great. Let's see. Unfortunately, it doesn't seem like there are any more questions, and Professor Iannotti does have to leave very, very soon. So I think we're going to go ahead and close with that. And I just want to thank you so much, Professor Iannotti, for taking the time today. It's been wonderful to hear about your research. You're so important. Your research is amazing, fantastic, and so important. I hope that we can stay in touch in the future. And please, for all the attendees, we will be having another population health lecture later next month, and we will be in touch with that information. And I'd just like to thank all of you for attending, and thank you again, Professor Iannotti, and for a wonderful discussion.
Thank you. This has been a pleasure.
Yes, thanks a lot. Take care. Okay, bye-bye. Bye-bye. Oh, for those of you